Hi everybody, so I'm Lincoln. So I'm a Year 2 medical student at NUS. I think sometimes there will be stressful times, but most of the times you have a good support network. So I guess I won't say that it's very stressful, but there are definitely times where you feel that studying will be a bit intense. So there will be periods of stressfulness. But fret not, there are very good support networks in medical school itself. So for example, there's a counselor-counselee system where you are paired with a senior who will guide you through medical school, as well as you have good friends around at NUS Medical School to guide you along and to share with you tips and tricks when it comes to exams, and also like to help you through this system, this quite stressful period. But I feel that one important thing is that in NUS Medical School, we have really good support network. So there will always be peers around, seniors around to help you and to pull you through this difficult period, especially during exams. So for me, I personally have very good seniors to guide me along. So for example, in my situation, I have something called a lineage. So a lineage is where we are paired with like seniors from different levels. So we are paired from seniors from year 1, year 2, year 3, all the way to like house officers who are there to guide us in every aspect of our life. So I think this is a very unique aspect of NUS Medical School because we really have like alumni who are already working, yet still quite close in contact with us to like help us with anything we need. So next we'll also talk about like for stressfulness. I don't think it's very stressful is also because we have good like professors to guide us around. So whenever we need like help, we can always ask them for consultations to find out more about what we don't know or what we might know and not really sure about, so that we can probably like do better for our exams as well. Yeah. I think the student life here at NUS is very vibrant because firstly we have a big cohort of 280 to 300 students. So there's a lot of opportunities to make friends, and at the same time there are also a lot of like CCAs, co-curricular activities, projects that we all can try out. So we also have, because since we're also part of NUS, we also have like NUS CCAs that we can be part of. Yeah, so there are CCAs that are sports, there are from arts, there are from a wide variety where you can fulfill your passion and interest. And I think for me, because year 1 I stay in hall, so I really do have an opportunity to participate in hall activities as well. Yeah. I think it's really about the people in medical school, like the people, the peers, your seniors. They are really the one of a kind, to guide you through medical school because they have been there themselves and they are also going through this process with you. So they really understand your problems and you'll share happiness, share sadness, share any single moment with you to make sure that you can have a good time in medical school. Although there are some times where you feel down, but they're always there to pull you up and guide you through this difficult process. And at the same time, about the facilities as well, because there are so many facilities in NUS Medical School and you can use them to help in your learning, to aid in your learning, and that is really something that's very wonderful about NUS Medical School. Yeah.
Hi everyone, I'm Singer and I'm a Year 2 medical student this year. I think in medical school, we're trying to shift away from didactic learning style into one that's more active and one that involves more participation and collaboration. So actually, we have lessons called collaborative learning cases. So in those lessons, we actually come together as a team to discuss on various clinical cases where we can really learn about things from a real case scenario of a patient. And I think that's one of the interesting things that we have here. And I think other than that, there are also various opportunities for us to learn. For instance, where I am at now, this is the Anatomy Museum. So as you can see, there are a few specimens around here, and we actually use these specimens to really see anatomy come to life. So we can really see the various parts of a human body, and I think that really helps us visualize things which will make it a lot more applicable as well when we go on to our clinical years. And other than this, we also have this thing called the Virtual Interactive Human Anatomy Program, where we actually put on glasses, so it's like a 3D stimulation kind of thing, where we can really control with a remote control and try to see how a human body looks like. And really remove and peel off layers and to see how it looks like underneath the skin. And I think there are a lot more other opportunities actually. For instance, we actually have simulation programs where we actually have real humans coming in and we actually do real clinical examinations on these people. And I think that's one of the more interesting things because when we progress on to graduate and work as a doctor, we actually really spend a lot of time treating real patients. And I think in the school integrating that into our lives now really prepares us for the future. Yeah. Actually, there are quite a few study spots and I really love coming to school to study. So for me, one of my most favorite study spot would be the medical library. So it's located in this building, MD6, and it's on level 5. So it's a really, really big room and there's a lot of spaces for us to study together. And it's a place where we can meet a lot of our friends as well and yeah, spend time learning things together. Other than that, there's also a house room at MD1. So in the house room, we spend time with our individual houses and get to know our peers, our seniors and our juniors. And it's very nice because like in between studying, then we can take a break as well. Yeah, this is also another spot where you can study. And in fact, over here, you can even get professors here to teach you about the human body. And I think that's one of the more interesting things about being in this place.
Hello, prospective undergrads. I'm Zijian, a Year 4 nursing student. First of all, I'd like to thank you all for participating in this camp, taking time off from your precious holidays, or just generally making time to come here to learn more about what we have to offer in this school. So currently, I'm in one of the labs where we practice our practical skills, where we learn basic skills such as transferring our patient from chairs, wheelchairs to beds, etc., to more complex techniques such as wound cleaning of all different kinds of wounds. In school, we'll learn the basic ones, definitely, but generally we'll learn the basic principles behind all this wound cleaning, as well as insertion of certain tubes in certain areas which you may find disgusting now, but as you pursue a medical field, you find that they're probably very common. Nursing wasn't my first choice, to be very honest. However, after coming here and being exposed to the different faculty members, such as our professors, our lab tutors, to even some of our clinical instructors within the hospital, I've been exposed to how intellectual and how knowledgeable and even how skilled these professionals are, and their passion really touches me. Nursing, as some people may say, isn't a very glorious job. It's noble, but not glorious. However, I feel that nursing is an actually very, very intellectual career, where you have to learn the very minor, intricate details behind why we do certain things, to being extremely careful when we manage certain patients and conditions. We have been told that nurses care while doctors treat. Well, caring seems like a very simplistic concept. Our parents care for us, our friends care for us, and such. So what actually does this notion of care means? In nursing, our care requires us to dedicate our time, knowledge, skills, and empathy when we come to care for our patients. Speaking of care, it can be something as basic as changing of clothes, toileting, to even showering, which is something we do every single day. However, care can also mean caring of specific wounds, like amputation wounds, or even wounds where you even have some sort of fungus or maggots growing in them. In fact, I've taken care of a patient who are undergoing this kind of special therapy where they actually use maggots as a way to clean up the dirty parts of the wound. And then what we have to basically do is to ensure that there's moisture and oxygen such that the maggots can actually continue thriving on these dirty tissues, so that they can effectively wipe out all those dirty tissues and keep the wound clean. Of course, this is an extremely complicated notion that you may not even learn in school, or may be exposed to it in a very small kind of exposure. However, all these kind of skills is actually what you can actually gain through our clinical experiences. So look forward to your clinical experiences and really pay attention to what our teachers have to say. They have many jewels that they can impart, and trust me, our teachers are extremely passionate and loving bunch of people who are extremely skilled and really caring towards the students. Alright, meanwhile, I hope you do enjoy your experience in this camp as well as the module they'll be undertaking in nursing. In the meanwhile, feel free to talk to your seniors or any person that you know are in nursing. I believe most of us will be more than willing to share about our experiences. Alright, in the meanwhile, thank you, bye-bye.
Hello prospective students, so I'm a year 3 nursing student, and today I'll be sharing more about my clinical experience and hopefully what you'll be able to experience if you do come into nursing. So I think one very memorable experience was when I was in a gynae posting and I managed to see an actual delivery of the baby like right in front of my eyes, and it was very shocking and I did not expect to see it so up close, and I actually helped to assist with the delivery, and it's something that I will not forget. And I think another experience was when the first time I did an injection for an actual patient during one of my postings. I mean, we always practice it during like our skills lab, like our labs and stuff, but it's not the same when you do it on an actual patient. There's a lot of tension and a lot of fear, but after I completed it, I was very satisfied and very proud of myself. So I think one thing about nursing that is really very rewarding is when you are able to apply these skills in real life to the patients that you meet, and to actually see that, oh, I did quite a good job and the patients are satisfied. And also just interacting with the patients, learning about their life stories, their different troubles, and just being able to help them and be there for them. So yeah, I think that nursing all in all is a very multifaceted sort of career. You know, it's not just about practicing skills, it's not just about caring for the patient. There's a lot of things. It's a very multidisciplinary job as well. A lot of collaboration with physiotherapists, doctors, occupational therapists, and you really get to see how every medical professional works together as a team. There's always help from the doctors, your fellow nurses, the other allied health professionals. So don't be too afraid. I know it's a very big jump trying to come into this medical field, but I was the same as well, but actually now I don't regret it one bit at all. So yeah, I hope you enjoy this camp and you learn a lot about both the medical and the nursing field. Thank you.
Hi, I'm Ethan. I'm a year 2 medical student from NUS. So the medical school curriculum is actually split over 5 years. The first 2 years are known as the preclinical years, which is where students learn about the basic medical sciences. So I myself am a year 2 student, and I'm currently in my second year of learning basic medical sciences. In year 1, we learn about what's normal about the body, so things like anatomy, so your hand, your head, your neck. We also learn about physiology, which is how the body works, and we learn about biochemistry, which teaches us about the molecular basis of processes in our body. In year 2, we move on to more clinical aspects, so things like pathology, which is the diseases of the body, and pharmacology, where we learn about the drugs to treat these diseases. In year 3, we move on to our core clinical rotations, with rotations such as internal medicine and general surgery. In year 4, we tend to delve deeper into the more specialty postings, such as obstetrics and gynecology, pediatrics and ophthalmology. And finally, in year 5, before the final MBBS exam, a lot of the students do what is called a student internship program, where they shadow house officers, which are junior doctors, and they start to take on more responsibility as they prepare themselves for the working world. A typical week in medical school usually lasts quite long, spanning from Monday to Friday. Typically, lessons will run somewhere from around 8 AM to 3 PM. We used to have in real life lectures, but currently because of the COVID-19 pandemic, a lot of these lectures have moved on to Zoom. However, at times we do come down to campus to go for in real life tutorials, which is a good opportunity for me to meet some of my friends. Other than that, in year 1, another type of lesson that we will get to experience would be anatomy hall, where we actually get to go down and see real-life cadavers to learn more about the anatomy of the body. Other than that, out of my free time, I actually do spend some time teaching my juniors, and I do feel that this is a very important part of my medical school life because this helps to promote collegiality within the faculty, and it also helps me to pay it forward, teach my juniors what my seniors have taught me. Typically, per day, I have roughly about 5 hours of lessons, but this can vary based on the schedule that the school has set out for us. There may be some longer days where days can start as early as 8 and end as late as 6, but those days are few and far between. The school does ensure that we get enough time to rest, and some weeks can be less than 5 days and can only be roughly about 3 days. I think undoubtedly my favorite part about NUS Med will have to be the people. I think I have met a lot of people around me that share the same passion as me and want to help other people as well. And I think that really drives me to study harder and be a better doctor in the future.
Hi, I'm Shimin. I'm a second-year medical student. There are really so many different projects and CCAs for us to join. So there's actually like medical school related projects. You can even take part in NUS projects, and you can choose to live on campus, such as in halls or residential colleges. So many different people in medical school actually pick and choose to customize their own experience to make it what they would like it to be. So for an example, in medical school, there are overseas community involvement projects, there are local community involvement projects, and you can even join medical society where you can plan many different activities for our student cohort. So for local CIPs, there are actually a wide array of things for people to take part in. There are projects that advocate for youth outreach, health screening projects, and even animal therapy. The overseas projects actually reach out to the overseas communities in developing countries, and many students also pursue their own interests in the medical society. I also know many peers who take part in research projects to further their interest in areas of specialty that they wish to look into in the future. Other than life in medical school, there's also a very enriching and diverse life outside in NUS, where there are many CCAs to join and student societies. So speaking about hall and residential colleges, each college and RC has a different culture and many different unique CCAs. Personally for me, I stayed in King Edward VII Hall, and I really enjoyed the welcoming and relaxed culture there. There are really many different CCAs to join, and they're very welcoming and open to people coming from different experience levels. I think lastly, your uni experience is up to you to customize, and the wide variety of CCAs is free for you to pick from. And medical school has many people with many diverse interests, and it's very inspiring to see everyone pursue their own passions. My favorite part about medical school is definitely meeting people with similar passions and working together with them on many projects.